Let me just tell you about who I am. I am Dr. Sabine Elize, board certified family medicine physician, CEO, and co founder of Cornerstone Medical Group here in Coral Springs, Florida. You know, as a physician, pastor's kid, wife, and mom, I've come to realize to be healthy and well, you can't just address your physical health. No, that is why I help men and women reconnect their physical, spiritual, and cognitive health to bring satisfying wholeness to their lives daily. And I'm so happy that you could be on so that we could discuss this today. Today, we are going to be speaking about arm pain, wrist pain, arm pain, wrist pain. So something occurred in the last month that we all know that you are well aware of. We are all on lockdown, essentially. We're all at home. So it's devastating because the numbers are telling us for every one individual who is diagnosed with coronavirus, that's 100 individuals who lose their jobs. And that's very saddening and it's very concerning. So we're always thinking about those individuals. But there's also a lot of individuals who are still having the opportunity to work remotely. And when we're working remotely, what's occurring? Well, we're happy because we still have a job for many of us. Many of us are still excited about that, and we're looking at the odds. But in our working remotely, what has occurred? We have a new office space. So what is our office space becoming? Our couches. What else is our office space coming? Someone kind of throw some in there. I see someone else he wrote here, our couch. Someone else wrote here, our kitchen table. That's correct. That's our new office space. And the biggest one that's an office space that I see that is most damaging to us is what? That's it, our bed, our bedrooms, or just our bed is our office space. And what happens? Right now, you've been doing that probably for about we're looking into 5 weeks now that we're going hardcore in our quarantine and staying at home. And now we're beginning to develop these aches and pains in our hands and in our wrists and shooting up our forearm. And the reason for that is because you have horrible ergonomics. So what's our ergonomics? Our ergonomics is our great medical word for just saying that your setup is completely wrong. And what you're beginning to feel are the symptoms of carpal tunnel. So you go ahead and write that down, put that in the chat. You can put CP as an abbreviation, carpal tunnel. We're going to talk quickly about what that is. And after speaking about what that is, I want to give you a couple of tips to make sure that we could stay away from that, not just during this quarantine coronavirus that's going on, but even after. So now and after, I want to give you those tips to know what's important. So the first thing is, what is carpal tunnel? So carpal tunnel syndrome actually occurs when our median nerve, that's one of the nerves in our hands here, it has too much compression on it. So our median nerve, anytime that we have a nerve pain, that's when we feel like that electricity, that's when we feel that tingling, that's when we feel that numbness that starts coming in. That's what is causing some of that nerve pain. That's how we identify as physicians that this pain isn't just any pain. This pain is nerve pain. So those of you, again, who are beginning already, who are working remotely from home, if you're beginning to feel some of that numbness, that tingling into your wrist, into your hand, going up your forearm, there's that carpal tunnel that's sitting in. And why is that occurring? It's because your workspace has now become your bedroom, your kitchen table, your dining room, or the couch. And we have to get out of that workspace. So we need to, first of all, get in a correct workspace. So we're going to talk about, now that we know what it is, what can we do to avoid it and set ourselves up differently at home so that we can still do the work that we need to do remotely and still be able to not have all those aches and pains, okay? So we said that it's the nerve, it's the median nerve that's causing this pain, it's compression. So when you have too much pressure that is here on the wrist, that pressure gets translated in deeper down into the median nerve, and then from there, that's what's causing those symptoms. So for example, if you are crouched up on your laptop working and you're kind of leaning on it for all these long hours, you're causing more pressure in that area. If your arm is remaining in a flexed position for long periods of times, you're causing more pressure to that median nerve right in that area too. And there's certain jobs that people do that will cause more pressure. If you work with tools and the tools that you work with vibrate, that causes more of that pressure there too. But the most common cause of carpal tunnel syndrome, it is usually work related. So number one, what do? We get the correct setup. We get the correct setup. It's a 90-degree angle that you want to be at. That's very important when you're working. You want to be at a 90-degree angle. What do I mean? That means, like, just right here. I'm going to stand up a little so you can see it. So you want your elbow to be in this 90-degree angle when you're working, and you want to be able to make sure you're not putting too much pressure here at your wrist. That's one of the first things that you want to do. Number two, the other thing that you want to do is please, for the love of God, get out of that bedroom when you're working. Can someone write that down and throw that in the chat? Out of the bedroom. The bedroom is not there to become a new workspace, and you really shouldn't be doing any of that work in bed because, again, that ergonomics, your setup is completely wrong, and it's going to be more damaging to you than beneficial. And in all actuality, you're not going to have the stamina to work the way that you need to work for possibly the number of hours that you need to work. So definitely, I see someone already put it in the chat there, out of the bedroom, of course. So number one, we want to make sure that our elbows are 90 degrees. Number two, we want to make sure, of course, that we are not putting that pressure on our wrist when we're working because we are working more remotely now. And then number three, we want to get out of the bedroom and get in the correct space. So the best place that you could kind of be, and I'm going to just go over this briefly, but if you want to find out a little bit more, please send me a Facebook message or Instagram, send me your email, and I'll go ahead and send some information over to you. Just hit me up there so that you could really have this printout and kind of seeing what that looks like. Okay, so you want that 90-degree angle. You want to be outside of your bedroom. You want your feet flat on the ground when you're working. You want your feet flat on the ground when you're working, and you want to make sure you're not putting that pressure there on your wrist. None of us know how long this is going to be going on, but even outside of if we are working remotely just for now, I'm not going to be surprised this coming out of this quarantine time that many companies will realize that, hey, we could do a lot more work remotely. So I want to give you the tools and tips that you're going to need, not just right now during this quarantine period, but even afterwards. And what we are seeing the most, what I'm getting a lot of calls about with my telemedicine calls, and even some of the patients that I am seeing in the office, is that they are having some of these beginning symptoms of carpal tunnel. So again, we know that there's many different reasons for arm pain. If it is not carpal tunnel, of course, then I want you to go ahead and call your physician and really specify. I got a message from one of the dentists earlier that usually is one of our Tuesday Transformers, and she's one that just her work in general is going to cause a lot of this ache and pain in her wrist and arms, but there's more that you can do with that. Remember, medicine is not one size fits all. So I come on here to give you your tips on just the highlights of it. But again, what do I always stress my Tuesday Transformers? You need a physician. You need a physician that understands you, that you understand, that it's just a good fit so that you can understand and know what is going on with your health, all right? So that's all I have for you.